It's time for our friends on the other side to tell us what they have in mind. And we'll see how the American people feel about their ideas.
I would say to my dear friend, the Majority Leader, we are not celebrating. We are relieved that millions and millions of people who would have been so drastically hurt by the three proposals put forward will at least retain their health care.
That, of course, Senate leadership from both sides of the aisle showing some humility in the late hours of the morning the other night. That after the Republican-led chamber failed to make good on its promise to repeal and replace Obamacare. But President Trump is not taking that setback quite the same way. He's demanding that all day today on Twitter that the senators keep trying. One of the tweets saying this: after 7 years of talking repeal and replace, the people of our great country are still being forced to live with imploding Obamacare. So what could come next and what could we expect? Andy Slavitt is a former acting administrator for the Centers for Medicare and Medicaid Services. Dr. Nicole Sapphire, a board-certified radiologist and physician. Welcome to you both. Andy, let me start with you. One of the president's most recent tweets this morning threatened basically to withhold subsidies, that are forked over to pay for low-income people to help them. He writes this: if a new health care bill is not approved quickly, bailouts for insurance companies and bailouts for members of Congress will end soon. So can you explain that it is within the administration power not to hand over these payments, or $7 billion basically a year, and it's due in 3 weeks? Can he actually cut the payments to try and force the legislators back to the bargaining table?
Well, he certainly can, but I don't think he should. I think what this debate is really all about, or should be all about, is how do we get better ideas from across both parties that advances health care for more people, makes it more affordable, and by a large number, by close to 70%, Americans want both parties to work together on those solutions. So there's an opportunity now, and I think holding hostage subsidies for low-income people to help them buy insurance would be a very big challenge, because it would create higher premiums for the middle class, which is exactly what Republicans don't want to do. So hopefully that's not where we're going to head.
So what should the president do?
Well, I think the president should tell his team to come to him with the best deals possible. And I think his team in the Senate should say, we're going to go for 60 votes. I think they should listen to Senator McCain and say, we're going to only look for ideas that go through the committee process. We're going to push hard. We're going to make the Democrats try to come to the table on the things we think are important. But we're hearing the American people loud and clear, and we're not going to rush something through that doesn't make sense. I do think these cost-sharing reduction payments ought to be made. I think they ought to be appropriated by the Congress, and hopefully they can see fit to do that.
Dr. Sapphire, I mean, you're a practicing physician. What advice would you have? How can they get to, as Andy says, 60 votes? How would you change John McCain's mind? Is that even possible?
I don't necessarily want to change Senator McCain's mind. As a native from Arizona, I respect this man very much. And, he's not voting for his next campaign. He's not voting for his next election. So he's voting from his heart. What Senator McCain has said, and what he's always said, is he wants a full repeal of the Affordable Care Act. But with that, what the Affordable Care Act initially said was they valiantly wanted to increase coverage for those uninsured, while also getting a handle on health care costs. And the one thing that the Affordable Care Act didn't do, they didn't do anything towards that. Yes, we have millions more people covered, but they did nothing about health care reform. They did not improve the health care system, and that's what Senator McCain wants to see. The only way that he's going to get anywhere is he wants to see how we're getting a handle of our health care system. How are we going to stop inundating our physicians with this administrative burden, and how are we going to provide better health for our patients?
Well, doctor, I mean, specifically, what would you suggest? What would you like to see in the bill in order to try and achieve that?
Well, how much time do we have? But let's talk generals right now. And I know Mr. Slavitt really knows about this, and I actually think he believes in this. He's a very smart individual. He knows a lot about health care. We talked about tort reform when they began the Affordable Care Act. Where is tort reform? You still have defensive medicine. Now physicians are seeing millions more patients. We have less time with these patients. They're having to throw unnecessary testing and just overutilization of the system because we're seeing so many patients, but there is no protection on our end. The malpractice is out of control. We are having to pay millions of dollars in malpractice. We have no security when it comes to these lawsuits. And that's just what it's doing. It's just a terrible system right now, and we're not protected. So tort reform is #1, absolutely.
Andy, do you see tort reform as #1 priority? What else would you suggest? And you're a Medicaid expert. You've got the issue with Medicaid expansion. A lot of people are thrown in the Medicaid system, and they don't necessarily have the doctors to cover them.
Well, look, I think I put out a paper with a Republican from the Bush administration on how to look at Medicaid reform and how to focus on Medicaid reform. The great news is Medicaid is reducing low birth weight babies. We're carrying more kids to term. It's taking care of our seniors. It's taking care of people with disabilities, which nobody else in the country, besides the Medicaid program, is willing to take on, and that's where 40% of the expense goes. So these are important programs. They're obviously important to senators like Senator McCain, but we do have to recognize that there are things about the ACA that we need to make better and we need to fix, and Democrats need to be willing to come to the table and say that. Republicans, well, specifically, we should make sure that we're getting the health care more affordable for the middle class, because I think we've done a nice job with people in Medicaid. Well, I think look at what they did in Alaska is what I would recommend as a great model. Alaska put in place a reinsurance pool. That reinsurance pool cost several $billion dollars. It would cost several $1 billion across the country, and what it did was it brought insurance rates from an increase of about 50% to an increase of under 10%. And we just need a way to deal with some of the sicker individuals in the risk pool, particularly in smaller states.
Right, so but with that comes the high-risk pools, which we have talked about. We need to adequately fund high-risk pools. That doesn't necessarily mean cost-sharing for our young, healthy individuals who are having to pay for these older individuals who have chronic illnesses, and many of them which are self-inflicted. At some point, we need direct access to primary care. We need positive incentives for preventative medicine and healthy behaviors. You know, for example, I had a patient recently who came in. She had a mass, clearly a breast cancer. She's overweight. She smokes, and she said, well, I didn't get my screening mammograms because I don't like the feeling of the compression of a mammogram. But yet she is on Medicaid, and everything's going to be paid for her, this advanced diagnosis. And she told me herself she has no desire to quit smoking because it brings her happiness, and she likes soda.
You know, that's the health issues. There's the prevention. And clearly, we've got to improve in this country. Just very quickly, 10 seconds, doctor. Do you think we'll get someplace with the health bill finally?
You know, I really don't know. I think the only way to get Senator McCain to get on board is to change the way that we are viewing health care, and we have to stop just talking money. We have to talk about our health system.
Andy?
I'm feeling hopeful. I think if we work, I think we have to work together. I think both parties need to come together. If we don't do that, the American public's going to be frustrated with all of us.
Yep, well, they're frustrated right now, and we'll see what happens in the next 2 weeks, or certainly. Mark Meadows, Freedom Caucus chairman, says that he expects a bill by September, so we'll see. Dr. Sapphire and Andy Slavitt, thank you for joining us.
Thank you.